EMS 1, Medic 1, EMS 15. You're en route to missing persons, 6-year-old female, red-haired, along with a geriatric patient who suffers from Alzheimer's, wearing a white button-down shirt, blue ball cap, last seen approximately 2 miles east of US 264 and Lazy Lane.
EMS 15 en route.
EMS 15 en route at 1213.
So it is an EVOTL, so it is literally a flying vehicle. And so how we're going to utilize it is we're going to utilize it not only for 911 calls, but we're going to use it for surveillance on the sheriff's office side. We're going to use for risk assessment, damage assessment on the emergency services side. If we get a call out for search and rescue, we're going to use that.
Slide County 911, what is your emergency?
Hi, it's my grandpa. He just collapsed. We were walking to the mailbox and he said he didn't feel right and he just fell.
Just to confirm, he is not conscious or breathing, correct?
853 Sheriff's Office, show AD drone 1017 the location, reference possible cardiac arrest.
853-10-4.
Drones deploying equipment and paramedics. Jetpacks.
AI confirms opioids, vitals are critical.
Artificial intelligence.
Suspected opioid overdose, naloxone recommended.
And autonomous driving ambulances. The future of EMS is anyone's guess or part of their wildest dreams.
I really believe in the future we're going to be on a self-driving ambulance and you're going to be a one-man show in the back of a truck because you and a robot are going to be loading up the patient in the back of a truck and you're going to sit in a self-driving ambulance and be able to transport that patient.
50 years ago, we could have not foreseen EMS providers operating with such an advanced scope of practice.
So no pain, nothing, just kind of weak feeling.
Performing skills previously reserved only for physicians. 12 lead ECGs, endotracheal intubation, and electrical cardioversion. Imagining the advancements that could occur in the next 50 years may be nearly impossible.
Central from EMS 15, search sector 2. Not located anything, moving to sector 3, and I will advise further momentarily.
Finding out where we need to be in 50 years is extremely tough. And maybe this is because the future is so cloudy about what the future of EMS is. What we need to make sure that we remain is adaptable and our rules are not a hindrance to the counties, and that we keep current with modern day medicine.
I'll be a provider today.
And as technology comes, we adapt and adopt that technology.
And then we can go through your list of meds and then make sure that nothing's contraindicated based on your blood pressure or your heart rate.
With advanced knowledge and the tools to do it, paramedics are already treating patients right where they are.
97.5.
And working to eliminate unnecessary trips to the hospital.
Going 2,500 units per hour.
As artificial intelligence becomes second nature, it will save time and money, not by replacing paramedics, but helping reduce burnout and improve patient care.
Both lower areas, upper limb.
Artificial intelligence is going to prove to be some huge challenges, and I think it's going to be hugely supportive. I think that's going to help with diagnosing of patients, destination determination of patients. Hospital space isn't getting any easier. The telemedicine is becoming more of the norm. So I think the technology through that piece of it is going to be make this environment look very different in the next 50 years.
How we doing?
All right.
Not a bad flight, huh?
While technology is always changing, One thing will remain a constant for EMS providers: to provide the best care in the quickest amount of time.
Central from EMS 15. I have a visual on the subjects. I'm going to attempt to land and make contact.
Let the future go where it may go, and make sure that we stay on that cutting edge. If you can't tell where the future is, sit back, buckle up, and hold on. And let's make sure that we can carry it into the future wherever it may go.
Smarter, faster, and using technology to our advantage. The future of EMS will always have one goal: protecting North Carolinians.